very frequently after a mastectomy, or particularly mastectomy and reconstruction, people come in with chronic pain and they complain that they can't wear a bra, or they have this pain that's just radiating into their axilla, and it truly makes them miserable. That's probably because of where the T4 and the T5 nerve come up through the chest wall, along with a small vessel that gets cauterized, resulting probably in a small neuroma. With a simple injection of 1 cc each of 4 milligrams per mil dexamethasone mixed with 1 cc of 0.5% marcaine, right in the trigger point, can relieve pain, and in 70% of cases, all you need to do is one injection. About 20% of the time, you may have to do 2, and maybe in 10%, 3. So this pain often causes this radiation across the breast and up into the axilla. So when they come and they have diffuse pain, the trick to finding out whether you can help them is whether they've got the trigger points on the chest wall where the nerve is. So if you push down and you find that, you know, you're highly likely, 90% likely to be successful. The first thing we're going to do is determine whether there's any point tenderness that would confirm the presence of a neuroma. So what I'm going to do, Laura, is I'm going to just put my fingers along the edge here, and I want you to tell me if there's something that, one place that is the most tender, right there.
Mm-hmm. That is very tender too. That is very tender.
So let's try and find the spot that's the most tender, not here. Not so much there. Probably right there.
Mm-hmm. Yeah.
Right here, right?
Yeah.
Okay. So we're going to mark right there. Okay, so as you can see, just again, this kind of 6 o'clock, 3 o'clock, and 6 o'clock, 9 o'clock. So on each side, I'm going to inject the mixture, the 2 cc mixture. I draw it up, obviously, with an 18-gauge needle, and then use a 30-gauge needle because it causes the least pain and has the least chance of causing any kind of damage to the implant, which I will move out of the way. Okay, so now I'm just going to clean this off, right, because we just want to make it super clean. I'm going to double check again that this is the spot.
Mm-hmm.
All right, so now I'm lifting the implant out of the way. I'm just injecting right down here under the, and I'm just getting this 30-gauge needle right at the level of the chest wall, and I'm just dropping 2 cc's of this mixture in, and then just making sure that I'm just at the right level, lifting the implant up, and you can feel it. I'm on the right spot. Sorry about that.
It's okay.
Okay, but because it's such a tiny needle, it doesn't hurt when you come in the skin. I'm just going to stop there and rub that in a little bit. And look, you're not even jumping off the table. There's the first, see, a smile instead of like, oh my God. Okay, so that's great. So we're going to then come here and make sure that, again, I've got the right spot.
Mm-hmm.
Right there.
Yes.
So right in there, I'm just going to drop the, right in at the level of the chest wall. It goes a little bit slowly because it's a tiny needle, but we want to make sure that we're really in the right spot. I feel like I'm in the right spot. Can you feel that? Does that hurt a little bit? Same kind of pain you're talking about?
Mm-hmm.
Okay, great. If I push here, no pain, right?
Mm-mm.
So before you had about a 7 or 8 out of 10,
Mm-hmm.
and now?
Not even. Barely a 1. Nothing.
Fantastic. That's a good sign. And here, how about here?
No, there's no pain anymore.
Okay, that's the kind of result that you want to see. That's how you know you're in the right spot. You want to rub it in for about a minute. Make sure you're getting sort of diffusely in the right area. How's this now?
It's getting better. Much better.
So how are you feeling?
Feel great.
And no pain?
No pain.
Even with pressure?
Nope.
And the arm, better?
all better. No
Okay,
pain.
so now you see, this is an incredibly effective technique to take away what we call, this post-mastectomy pain syndrome. And what is so incredible is that it works. It's quite simple. You can do it in 5 or 10 minutes. Do a careful history, careful exam. If they have the trigger points, you can be 90 to 95% sure that you're going to dramatically reduce their pain.